heroin, cocaine, alcohol, prescription drugs. 24.6 million people used illicit drugs in the last month in the United States. 6 times every day, someone in the U.S. dies of alcohol poisoning. 1 person dies every 19 minutes from a drug overdose. Making the decision to seek help for an addiction can be frightening. In 2013, 4.1 million people aged 12 or older received treatment for a problem related to the use of alcohol or illicit drugs. And after treatment, an equally frightening time arrives, returning to society again, clean and sober. Choosing sober living as part of a recovery program can be a life and death decision. Addiction is hard to hide. Chronic substance abuse affects almost every area of the user's life. Either under the addict's or alcoholic's own steam, or an intervention, or a court order, substance abuse treatment should start at an accredited detox and/or residential rehab program. Immediately following discharge from treatment, an aftercare program that combines continuing therapy, IOP, 12-step meetings, or alternative support groups is critical to getting a start on maintaining sobriety. But the road to recovery can be a rocky one. 50% of recovering alcohol and drug addicts will relapse at some time after initial treatment. And 68% of those entering rehab will repeat their stay an average of 3 times before they achieve significant sobriety. You see, they're feeling pretty good after rehab, and without proper support, they can start sliding back into their old behaviors, their old ways, and relapse, especially if they return back to the environment they used in. Entering a structured environment, a sober living home, after treatment will further increase the likelihood of achieving long-term sobriety. The first 30 to 90 days after initial treatment are the most critical for preventing relapse. Fresh Start Sober Living Homes occupy the space between inpatient care and returning home. Fresh Start provides independent living with accountability, continuing, and continuity of care for those in recovery who want success. At 6-month intervals ranging from 18 months post-treatment, recovering addicts who passed through some kind of structured sober living environment were significantly less likely to face relapse, arrest, and homelessness. Fresh Start provides clean, upscale, affordable, and safe housing in good neighborhoods. Here, the recoverees are in a ready-made, peer-based, and structured living scenario that keeps them connected in a fellowship of recovery. Here, the recoveree is removed from negative influences and triggers, and new supportive relationships are formed. And essential to sober living, there is zero tolerance for using drugs and alcohol. Fresh Start plays a partner role in the recovery process. We provide a structured environment that assists with the continuity of care recommended by clinical therapists and health professionals, independent living with accountability, and swift consequences for breaking community rules and using drugs and alcohol. Fresh Start Sober Living encourages health, abstaining from drugs and alcohol, home, having a safe place to live, purpose, conducting meaningful daily activities, and community, making new sober relationships. The decision is clear. If not Fresh Start, explore other sober living homes. Research indicates abstinence rates increase dramatically from a 6 to 12-month period compared to those who haven't participated in a sober living program. Recoverees have more success in staying sober after participating in a sober living environment. Fresh Start has observed sober living recoverees exhibit stronger tendencies to stay engaged in their recovery and tend to make the principles they've learned and adhered to while in sober living part of their daily routine. A Fresh Start Sober Living, independent living with accountability. For more information on sober living, call 312-238-8647 or visit Fresh Start online at afreshstartsoberliving.com.